In this presentation, the topic of intravenous access will be discussed.
Namaste. Today we'll be discussing how to provide patients with fluids and medications directly into their bloodstream, or intravenously. Intravenous, or IV access, is a skill that first responders should be comfortable with, as it can provide patients with immediate benefits. This is especially crucial for patients in critical condition. Now let's begin to discuss this in more detail.
The ability to obtain intravenous access is an essential skill for first responders. This allows for a direct connection to the bloodstream through a vein using a needle and catheter. It is obtained in order to provide rapid administration of medication or fluids to critically injured patients, such as in a trauma setting. By using an IV line, medications can have immediate effects, and fluids can immediately replace fluid depletion due to massive blood loss and shock. All critically ill patients require IV access in preparation for future problems. Major indications include substantial blood loss, pain management, medication administration, and anticipated future needs. IV access should be obtained through the skin, and the preferred sites for vein access in emergency situations are the forearm and antecubital fossa. Other sites include the veins of the back of the hand, groin, ankle, and top surface of the foot. Prior to IV placement, first responders must ensure that hemorrhage is controlled so that the drainage of blood does not make fluid administration useless. Short-length, large-diameter catheters allow for faster rates of fluid administration than do longer, narrower catheters. Therefore, the largest available catheter should be used. For fluid resuscitation, 2 large-bore catheters, 14 to 16 gauge, are required. This video shows the proper way to prepare an IV line. First, close the roller clamp of the IV line to prevent fluid from dripping out once the tubing is attached to the IV fluid bag. By moving the roller in the direction of the arrow, the tube becomes clamped and fluid will not flow beyond that point. Moving it in the opposite direction allows for fluid flow. Insert spiked end of IV tubing into the receptacle on the inverted IV bag. Hold bag upright with the IV line hanging from bottom. Fill drip chamber halfway by pinching and releasing. Now, open the roller clamp to allow fluid to fill the line up to the very end of the tube, making sure that no air bubbles remain within the tubing. Close the roller clamp again until you are ready to attach the tubing to the catheter, which will be done after the catheter is securely placed into the patient's vein. The following video shows the steps on placing an IV line. 2 important points to remember about placing IVs is to always wear gloves and to keep the bevel side of the needle up, as shown in this picture. Here are the steps in IV line placement. First, place tourniquet above the IV site closer to the body. Then, identify the vein. Note, the vein can be better visualized by utilizing angled light and having the patient make a fist. Next, sterilize the site of access. Again, ensure that the bevel side of the needle is facing upward, using the hand not holding the needle to support the underside of the arm and to pull the skin tight across the vein. Advance the needle and catheter through the skin with an upward angle, reducing the angle as you penetrate. Gradually advance catheter until vein is completely inserted. As you remove the needle from the catheter, apply pressure over the vein above where the catheter is located to keep blood from leaking out of the catheter. Try to place the tape over only the catheter, avoiding the tube connector, so that the tube may easily be removed and replaced. Then attach the tubing to the catheter. Finally, remove the tourniquet and quickly release the roller clamp on the IV tubing and set an adequate flow rate. Here are some additional points to remember. Gradually reduce the angle of the needle as you penetrate the skin. Also, IV placement in areas of swelling, burn, infection, or injury should be avoided. It is important to follow these precautions. Always use gloves. Make every effort to not poke yourself. Needles must always be capped when not in use. Also, never reuse needles in order to avoid infection. Lastly, protect the insertion site from contamination. The rate that fluids should enter the vein depends on whether or not the first responder suspects inadequate blood circulation, such as during shock. Trauma patients who do not show signs of shock will need to be administered an IV line in order to keep the patient hydrated and prevent the patient from going into shock. This is called maintenance fluids. Patients suspected of experiencing shock will need a larger and more rapid fluid replacement called a bolus. For the average adult, a bolus is 500 to 1,000 milliliters of saline fluid. After one bolus is given, reassess the patient for signs of improvement. If signs of shock are absent, follow the protocol for maintenance fluids. If signs of shock persist, give another bolus. Continue until the patient improves or you arrive at the hospital. There are several complications that can arise if intravenous access cannot be obtained or if it is improperly obtained. Lack of IV administration can lead to shock. Fluid resuscitation allows for rapid restoration of blood volume and blood flow to essential organs. Failure to address shock quickly can result in major organ dysfunction, including kidney and brain damage, heart attack, large areas of tissue death due to inadequate blood supply, excessive loss of body heat, coma, and ultimately death. Lack of IV access can also delay essential treatment required to stabilize the patient and prolong discomfort and pain. In addition, the proper technique of IV placement should be followed, as incorrect placement is associated with multiple complications, including infection at the site of puncture, swelling of catheterized veins due to the development of blood clots, arterial punctures, and unsuccessful punctures that can lead to infusion of fluids into tissue rather than into the bloodstream. In children, the most accessible areas tend to be the antecubital fossa and the ankle. In infants, the veins located on the back of the hand, top of the foot, and scalp are easiest to access. There are important points to communicate upon the transfer of care to the hospital. The mechanism of injury, vital sign status such as airway, breathing, and circulation, also known as the ABCs, the indications for IV line use, and lastly, the details of administration and events during transit should all be communicated. Materials and equipment to be used include gloves, appropriate catheter, tourniquet, IV bag with solution, sharps container, gauze, and dressing. In summary, IV lines can be beneficial in the pre-hospital setting for rapid administration of fluid, blood products, or medications, and thus are often utilized in anticipation for future problems in all critically trauma patients. IV access is essentially obtained from veins of the forearm and antecubital fossa. The largest catheters should be used for rapid fluid resuscitation. It is important to follow the proper techniques, as incorrect IV placement is associated with multiple complications. Take precautions to reduce risk for transmitting infections by wearing gloves and being careful not to poke oneself. Discarding needles safely and recapping needles when not in use.
I hope you have found this presentation useful. Now it is time for you to practice these skills so you may be better prepared in an emergency situations. Please feel free to ask any additional questions. Thank you for your attention. Dhanyavad.